Question, multiple choice. What is the most effective method of preventing the transmission of STIs? A, using barrier methods such as condoms, B, communication, or C, getting tested? The answer is B, communication. Communication with your partners, communication with your healthcare practitioners, and communication with your own body. Hi, I'm Samantha Bitty, sexual health and consent educator, and in this episode of Sexy Sexual Health Education, we're going to be talking about STIs, sexually transmitted infections. This episode is going to be a little more technical because we're going to run through definitions, categories, but we're also going to talk about something that's really important as it relates to STIs and our sexual health and overall health and well-being, and that is stigma and our sense of self-worth as it relates to our sexual health status. First things first, what is an STI? What is a sexually transmitted infection? A lot of times we'll hear the language STD or sexually transmitted disease, and the reason why, at least here in Canada, there's been a pivot towards using the language infection, not only because it's just a more accurate way to describe what the majority of people are talking about when they're talking about different health issues that are connected to sexual transmission, but also because the word disease carries with it a lot of stigma and a lot of fear. And what we know is that that fear and that stigma actually prevents people from doing the things that they can do to help prevent the transmission of STIs, like getting tested and having conversations with partners. A sexually transmitted infection is not necessarily the same thing as an infection that's caused by sex. Sexually transmitted infections are specific illnesses that are spread from one person to another, whether that's coming into contact with sexual fluids or the fluids that we often think of as sexual, like vaginal fluid, sperm, semen, and even saliva, or if it's a body part to body part coming into contact with something on the body that has the infection present, something like a cold sore, for example. That said, not every illness or infection that is sexually transmitted is a sexually transmitted infection. Sometimes there's just stuff that is communicable or easily spreads to another person doing the things that a lot of people do when they're having sex. Or it's the introduction of fluids into a body part that then makes that body part go a little bit reactive. So things like bacterial vaginosis, as an example, can be as the result of coming into contact with something like sperm that can throw off the whole climate of the vagina, but it's not a sexually transmitted infection. Or even more commonly, like a UTI, a urinary tract infection, which gets caused when bacteria gets thrust up into the urethra, which often happens when people smush their junk together. Pee after sex, even if it's with yourself. When we talk about STIs, we can talk about them in a couple of different categories. One of those categories is, what type of infection is it? Is it bacterial? Is it viral? Is it parasitic? An example of a bacterial STI is gonorrhea. Some viral STIs are herpes, both HSV 1 and 2, as well as HPV and HIV. And parasitic STIs are things like crabs and trichomoniasis. Another way we can categorize STIs, and sometimes what people are more concerned with, is whether it is curable or manageable. Curable STIs are things that you contract, you take an antibiotic or some sort of treatment, and it goes away. It doesn't mean that you can't get it again, but for the time being, it's no longer in your system and you can't transmit it to somebody else. And then there's STIs that are manageable, which means that it doesn't go away, but the symptoms can be treated or negotiated through things like medications, treatments or procedures, as well as lifestyle choices. What it looks like for someone managing a positive STI status can look kind of different person to person. With HPV and herpes, for example, Some people might have one outbreak when they first get infected and then never have an outbreak for the rest of their life, or they might have one a year, or they could have one every month when they get their period. It really depends. Knowing your STI status is going to help you to make informed decisions about the types of sex you have, as well as to help your partners make informed decisions about the types of sex you have. In the trivia question, the answer to the most effective method of preventing the transmission of STIs is communication, is because you can get tested, but if you don't tell someone your testing status, or if you don't tell a healthcare provider the types of sex you're having, you might not even get the right kind of testing for what it is that you might need to have checked out. And I also touched on being in communication with your body. Knowing what's normal for you is going to help you to assess when something changes. Everybody's body parts can look and act kind of differently. And one thing that might be, a red flag, so to speak, for one person might be totally normal for another person. And so knowing your body and knowing what's right for you can help you to know when it's time to be like, oh, I think a little something has changed in my lip area. But it's important to remember that the most common symptom of an STI is no symptom at all. And things that aren't sexually transmitted can share symptoms with things that are. Developing a testing plan for yourself based on the types of sex you have, how sexually active you are, if you're even sexually active, how old you are, all of those things are going to be factors as to how frequently you get tested. Not least of which, too, is how long it takes between a potential infection and when it can be detected accurately on a test. That is called a testing window. There are different types of testing based on which infection you're trying to detect. It might be swabs, throat, genitals, anus, could be a urine test, could be a blood test, could be a site test, which means you can only get an accurate result if you're presenting with symptoms. Things like herpes and genital warts, if you aren't having an outbreak, you can't necessarily be tested for it. There is a blood test for herpes, but that test won't tell you where or if ever you'll have an outbreak. There's also pap testing, which is not the same thing as other types of genital swabs. Pap testing happens for people who have a cervix, where a healthcare provider will take a few cells from the cervix to make sure they're all healthy. HPV, internal HPV, can take place on the cervix, which can cause abnormal cells, which can lead to cervical cancer. We can't test people with penises for it. Even if you're someone who doesn't have sex with someone with penises, even if you only have sex with people with vaginas, you still have to check your cervix. So get pap tested. The time window for how frequently people get tested changes kind of depending on the healthcare system that they're in. But typically speaking, it happens once you become sexually active and every couple of years, so long as the tests are normal or no abnormal cells are detected. But if abnormal cells are detected, you'll be testing more frequently to check in and see how they're doing. I'll be real, STI testing can be uncomfortable, physically uncomfortable, depending on the type of test that you're doing, depending on the type of body parts that you have. I will say it has come a long way. There's lots of testing that used to get done with swabs and holes that didn't want swabs and holes in them that is now done by urine. It can be far less invasive. A lot of clinicians will allow you to self-swab or to perform the test on yourself. So those are all really great advances. But one of the types of discomfort with testing that's super important to talk about is the emotional discomfort, the stress and duress and the fear that can get connected to testing for STIs and knowing an STI status.